Well, it's official. Australia has been dubbed the pain capital of the world. Alarming new research by the Global Pain Index shows 7 in 10 Australians experience body pain weekly, and a quarter of us suffer head pain just as often. But the study found most of us suffer in silence, with more than half continuing to work through the pain, even though it affects our concentration. For more, let's bring in our resident doctor, Tamara Hunter. Good afternoon, Tamara.
Hi, Tracy.
If we're in this much pain all the time, how can we cope?
Well, that's a really interesting question, and the survey itself was quite interesting. They looked at 7,000 people. It was an online survey across 14 different countries and 4 continents. So it was a really interesting snapshot of what pain might be in different cultures and different countries. And the index itself took into consideration physical pain, so body pain, the frequency, the intensity, the duration. It also took into account the emotional interpretation of this and also how it impacted on day-to-day living. So it was a really interesting snapshot to see that 88% of people do suffer with some sort of pain on a daily and weekly basis, and yet we actually have to work through it in our lives. So we do actually cope with it. We live with it.
We just get on with the job here in Australia. But the research also says Australians are more likely to suffer in silence, so no one knows about the pain we suffer. What are the common types of pain that we can put off going to the doctor for?
So 97% of Australians who answered this survey said that yes, they had pain every day, but Australians are amongst the least vocal when talking about their pain. Most commonly, people suffer with musculoskeletal pain, certainly lower back pain, neck pain, head pain. They're the sorts of pains that are probably more lifestyle induced. So simple conservative measures, perhaps relaxation, stretching, simple analgesia over the counter from the pharmacy, massage. But certainly if those sorts of pain cannot be overcome by these simple strategies, it's important to see a healthcare practitioner.
Well, let's talk about pain relief medication. How often is too much, and should we automatically resort to a pill or try and hold off for as long as possible?
Well, it's really important that acute pain settings need to be addressed to prevent chronic pain syndromes, because it's the chronic pain syndromes that are really hard to get under control. But a lot of the research does say that we should steer away from using opioid-based medications first up. So the codeines and the panadines, things that have opioid which are addictive and we can develop tolerance to. So once again, we should always start from escalating to simple analgesia, paracetamol, anti-inflammatories, and upwards from there.
And just quickly, do you think more people are leaning towards a more holistic approach or more natural approaches to relieving pain?
I certainly think there's a place for those things, and certainly doing those things first line, but it's important that if they're not working, that we should really see a healthcare practitioner early so that we don't be a victim of those chronic pain syndromes.
And no long-term damage.
Correct.
All right, Tamara Hunter, thanks for your time this afternoon and enjoy your long weekend.
Thanks, Tracy.